Welcome to Instrument Innovations. This is our next episode in the IUSS series of reducing IUSS. Today, we're going to talk about sustainability and waste reduction. I've got my guest on today, one of the Breakfast Club members, Alex Brown. I'll let him just go ahead and tell you about a little bit about himself, and then we'll jump right in. Go ahead, Alex.
Hey everybody. My name's Alex. I'm the on-site Sterile Platform Specialist over at UF Shands in Gainesville, Florida. My experience is mostly in the OR as a surgical tech, but I also have a lot of experience managing SPD, and I have a lot of interest in sustainability and cost savings in the OR. So today, that's what we're here to talk about is sustainability within the OR, but with our focus in SPD. It's something that's not really thought about a lot because it's pretty much universally accepted that waste is required for quality patient care. Until you really think about it, it's not really that's not really true. And most of the time, this is tackled from a higher level in the OR and not so much in the SPD. But if you look at the numbers, SPD generates a ton of waste. That waste is mostly the disposable wraps. So 225 million pounds annually is dumped into landfills that are just OR waste. And almost half of that is that disposable blue wrap that we use one time and throw out. For a single large healthcare system, that's 6,000 tons of waste a day in just disposable SPD waste.
Wow.
That's a pretty large impact.
Yeah.
So if we can eliminate that, we can see a big eco cost savings and actual physical cost savings. Just some other examples of waste in the OR that includes the paper products. We also have metals, glass, medication, gases, sharps, biohazard waste, and plastics. So that's where we mostly focus our waste reduction efforts is in those little areas. So we do a lot of recycling, refusal of equipment, so we don't use it at all because it's not needed for the case. Where data and analytics can come into standardizing sets and what's required for cases, and we can refuse right out. So, what kind of strategies are we using in SPD to reduce waste? The big thing at Shands, the facility I manage, we have been using Sonar and analytics to convert all of our items that we wrap into the reusable rigid containers. The effort has been massive. We started last year. Last year, we were processing, 7,000 sets a day that were wrapped, and we've gotten that down to only 2,000, which is a pretty massive reduction.
Outside, yeah.
Yeah. Cost savings with that. So about you get 50. You can purchase one usable sorry. So the cost savings for that is you can purchase one rigid container for about the same cost of 60 wraps. So you monetize that container in about 60 sterilizations, and on average, that container will be good 5,000 containers right across. And that was from a case study that was done at the Mayo Clinic. So you can see that over 3 months for a medium usage set, you'll see that it monetize.
Okay. So, Alex, just a quick question. What made you really want to jump into and start to reduce this? How did you start this, so to speak?
So my interest was peaked actually last year. I was
Hmm.
listening to a speaker. His name was Nestor Hernandez, and he was talking at a podcast called SP Green, sustaining the health of patients and planet. And this was last year in June. So that was really
Hmm.
what made me start being really interested in sustainability. That's when I started tracking and seeing the containerization project at Shands. I noticed a massive decrease in disposable wrap. And then around the same time, I was actually reached out by the OR who wants to start tracking these initiatives.
Hmm.
There's another organization, a nonprofit, that goes around assessing healthcare facilities, specifically ORs. They're called
Hmm.
Practice Green Health. For the last 3 years, UF Shands has been awarded specifically for their efforts in reduction of waste in the OR just as just high achievement and that reduction in that space.
Okay. And how has having a tracking system really helped you by reducing that waste and gathering that data? How has that helped you as well?
The Sonar, especially the initial implementation, included recording all the container types and sizes for all the instrumentation when we implemented.
Hmm.
This was helpful because we already had all the dimensions for all the wraps, like anything that's wrapped in the 48 by 48 wrap. You already had an idea of the dimensions of the instrument. So when they went to do the containerization project, not only were they easily able to track the progress of the project, but they didn't have to go back and size each instrument that was wrapped because we already had that data. So we just had to order the appropriate size reusable container and switch
Hmm.
it out. So the tracking system made it super easy,
Okay.
almost effortlessly. Also, we handled a lot of the procurement analytics as well. So, like when you do a large order, we also did all the container analytics, so you guys don't even have to worry about doing that once the set gets in, sizing all the instruments. That's already in there.
Hmm. So by doing this project and taking care of the waste reduction, it also helped your IUSS rate to go down as well, because you didn't have the holes in the wraps. Is that correct?
Absolutely. One of the biggest negatives with wraps is that it's not super robust.
Hmm.
Especially with the Shands model, we do a lot of transportation of sets across town because we use a centralized offsite processing facility. In that transportation, there's potholes, there's bumps, there's speed
Yep.
bumps. In those transport cars, while they keep them very secure, anything could happen. And just rubbing it, and the tape comes off, and the set's useless until it gets to the OR, and they have to IUSS it on site, which, as we all know, is not good for quality patient care.
Correct. Correct. Wow. So it sounds like this happened by doing this. You took care of a number of different things, not just the waste portion of it, but you helped it out with transportation. You helped it out as far, so the overall big picture is it took care of a number of different things.
Absolutely. You can see a big correlation in the analytics of quality events related to open sets or improperly wrapped sets very easily. Another, which brings me to the next point: training and time assembling. It's much easier, faster, and takes way less training to teach somebody how to assemble a set in a container versus how to assemble a set and then wrap it. Usually, an SPD will sometimes dedicate an entire FTE to somebody wrapping sets. And we also see all this new technology coming, all this new expensive technology with large footprints of auto wrapping or folding of wrapping that just takes a long time. And also, like I said, SPDs are small; they don't have that kind of footprint to
Mm,
support all this. So why not take out the middleman and not have to require those at all, and just use reusable containers, which are not only environmentally friendly but a massive cost savings for the hospital.
wow. Wow. So you're saving on all aspect, not just supplies, but saving with the FTEs. You're saving with the cost that you would spend to train. So it's a cost savings all around.
Absolutely. And even if you think of on the tiniest, smallest micro scale in supply chain, they're having to do this linear economy by ordering the wrap, using the wrap, and then it just gets disposed into a landfill or incinerated. Whereas with reusable containers, supply chain just has to order and receive one container, and that's used for years and years to come. That circular economy of waste is really, or we want to avoid that linear economy of waste and really get into that circular reusable. Um,
Okay. So if someone wanted to get started on this, how would you tell them to get started? What would be some of the first things they would do to kind of get set up to get started with this?
Definitely, analytics is the biggest driver of change. It's a big purchase when you want to convert all your wrap sets into a rigid use container. So it's going to be a big capital request that's going to require a lot of evidence. That evidence and that data can be hard to acquire unless you have a tracking system like Sonar or SQ Track that can collect that data for you, that you can present to your leadership to justify this really large purchase.
Okay. All right. Well, that's going to be all the time we have for now, folks. we're gonna probably hit this a little bit more here a little bit later. Um, I have my host today with me, Alex Brown. Thanks for joining us today, Alex.
Hey, thanks.
Is there anything else you want to add before we get out of here?
Absolutely. If anybody ever wants any help or assistance with reducing their waste inside their SPD or OR, I'm always happy to help and assist.
All right. Thank you, guys. Until next time.